Hello, and thank you for tuning in to this Oncology Data Advisor interview. Today, in honor of World Lung Cancer Day, we are here with Dr. Brian Whang to discuss the current state of lung cancer and low-dose lung cancer screening. Would you like to begin with introducing yourself and what you do, Dr. Whang?
Hi, sure. I'm the medical director of lung cancer screening at Hartford Healthcare in Connecticut. I'm a thoracic surgeon, and I'm happy to be here to talk to you about this very important topic.
Fantastic. We're definitely excited to have you here as well to hear more about it. So, to begin, would you like to tell us what is the current state of lung cancer detection and treatment?
Well, it's getting a lot better. Since we started introducing a fairly effective form of screening, this low-dose CAT scanning tool, we've made a lot of progress in reducing lung cancer mortality. The original studies showed a greater than 20% reduction in mortality. And the real challenge since introducing it, though, has been adoption. And
Mhm.
we're doing that. We're doing much better. In fact, as an example, here in Connecticut, we've gone from a screening rate of about 6% of eligible patients to over 23%. We're now like third in the nation in terms of lung cancer screening. And overall, the lung cancer screening rate has improved in the nation as well.
Definitely, that's really awesome to hear. So, can you give me a bit of a description? What is low dose lung cancer screening and how is it effective in detecting and treating lung cancer?
Well, it's a modified form of a CAT scan of the chest. It's very low dose radiation. It's like the same dose you get from a mammogram. And to put it into more perspective, if you were to take a transatlantic flight and take about 7 of those, that's about how much radiation you'd get. It takes just a few minutes. It's not invasive at all. There's no IVs or anything. It doesn't involve the use of contrast. You just lie there, and it's done literally in a few minutes. And you can often get a result the next day or maybe even the same day.
That's fantastic. And I know you're saying, you've gone from 6% up into 20% of this being used more often. So do you believe low dose screening will ever become a default part of preventive care in the same way mammograms and colonoscopies are? And do you believe they should be?
Oh, absolutely. Yeah, yeah. It's got a proven track record. And as I was mentioning, adoption's the real challenge. And we're trying to get the word out so that people are more conversant with talking about this with their own doctors. And it's worth pointing out um, that lung cancer has the highest mortality of all the cancers. If you add up colon, breast, prostate, lung cancer still has the highest mortality. So it's very important. And to the extent that people already know about breast cancer screening, for example, and colonoscopies and whatnot, it should really be part of the conversation.
In a bit of a different direction, I was curious to ask you what is being done to minimize the disparities underserved populations are experiencing in access to low dose screening and lung cancer treatment as a whole?
Yeah, that's a great question. Both nationally on a wide scale and at the grassroots level, there are things being done. We've recognized it for a while. In fact, the American Heart Association every year puts out statistics, sort of like a report card for every state. And part of that report card it involves looking at that very topic. So we're trying to use that data as feedback for what we need to do. Here in Connecticut, we've successfully introduced legislation at the state level to do more outreach in the community so that we can help to reduce those disparities in screening. We found that uh, minorities across all demographics are not getting diagnosed early enough or getting screening as much. For example, Asian Americans, the least likely to get an early diagnosis of lung cancer screening and least likely to get screened. So we definitely need to do more things like that. Uh, Other places are doing mobile lung screening, sending out giant vans that can perform the lung screening. And as a global effort, we're recognizing more and more how we need to modify the criteria for lung cancer screening. For example, there's some really compelling data looking at African American individuals that show that the so-called intensity of smoking is not as important as just the overall duration of smoking. For example, you don't need to smoke, a pack a day for many years. You can smoke less than that, but for the same amount of time and still have a high risk. We found that among people who eventually get lung cancer, if we'd had that more liberalized approach toward screening those individuals, we would have potentially caught their cancers earlier.
It seems like it's a really exciting time for lung cancer with low dose screening becoming more prevalent. I was wondering if you had anything you're looking forward to, in the near future, maybe the next year or two, of being achieved in lung cancer and the low dose screening as a whole.
Well, I would like to see those numbers improve in terms of outreach.
Mm-hmm.
Absolutely. There's a whole bunch of people. Just to remind you, 80% of lung cancer is caused by smoking.
Mm-hmm.
But we're also looking at people who don't smoke, that 20%. Again, to go back to the Asian American population, um, more than half of Asian American women who get lung cancer have no history of smoking. So there are some studies being done over here on the East Coast as well as the West Coast, looking at factors, both behavioral and potentially genetic, that have to do with why that happens. But yeah, there's still a giant unmined territory in people who smoke for that much larger proportion.
Final question I'll ask you is, in honor of World Lung Cancer Day, do you have any advice or words of encouragement you would share with your colleagues or anybody in the multidisciplinary team pertaining to the current state of lung cancer and the importance of low dose screening?
Be conversant with it, know the criteria, and the criteria are ages 50 to 80, what we call 20-pack year smoking history, meaning the equivalent of 1 pack per day for 20 years. Hopefully we'll see that go away and just see the, like I was mentioning before, the duration. Some major groups have already adopted that criteria, like the American Cancer Society. And the other criteria is current smoking for at least 15 years or have quit within that 15 years.
Thank you so much, Dr. Wang, for your time today and your expertise. We really appreciate it, and I hope you have a good rest of your day.
You're very welcome. Thank you so much.